السلام عليكم. معكم دكتورة أريج المسلاتي. Today we'll discuss drugs used in treatment of hyperlipidemia or dyslipidemia. The term of hyperlipidemia is used to describe elevation of lipids levels in the blood. Here we mean cholesterol, triglyceride, very low density lipoprotein, low density lipoprotein, and chylomicrons. And maybe we find low levels of high density lipoproteins. Chylomicrons, very low density lipoprotein, low density lipoprotein, أيضا another one, intermediate density lipoprotein, and high density lipoprotein. These are large molecules responsible for transportation of cholesterol and triglycerides in the body. So, if there's disturbance of the levels of these lipoproteins or these lipids, this may lead to atherosclerosis, and we know atherosclerosis is the major cause of myocardial infarction, cerebral vascular disease, and stroke. Here we have intended learning outcomes. By the end of this lecture, you will be able to answer all these questions. So that means you understood the lecture and you can answer any question related to anti-hyperlipidemic drugs in the exam, okay? Here we have a video to do quick revision about lipid metabolism.
Despite having a bad reputation as a high risk factor for cardiovascular diseases, cholesterol is an essential component of all animal cells. It is an integral part of a cell membrane, providing membrane fluidity and participating in a number of cellular processes. Cholesterol also serves as a precursor for production of bile, steroid hormones, and vitamin D. While the body can obtain cholesterol from food, many cells synthesize their own endogenous cholesterol. Cellular production of cholesterol is under negative feedback control. Low levels of intracellular cholesterol induce its own production, while high cholesterol levels inhibit it. Cholesterol, together with other lipids, is transported in blood plasma within large particles known as lipoproteins. A lipoprotein is an assembly of lipids and proteins. Lipoproteins are classified based on their density. Because lipids are lighter than proteins, particles that contain more lipids are larger in size but have a lower density. Different types of lipoproteins have different sets of proteins on their surface. These proteins serve as address tags determining the destination and hence function of each lipoprotein. For example, low-density lipoprotein, LDL, carries cholesterol from the liver to other tissues, while high-density lipoprotein, HDL, returns excess cholesterol to the liver. Major events in cholesterol metabolism include dietary cholesterol is absorbed in the intestine and carried via blood circulation to the liver. The liver packages its cholesterol pool, a combination of endogenous and dietary, together with triglycerides, another type of lipid, into particles of very low-density lipoprotein, VLDL. VLDL travels in the bloodstream to other organs. During circulation, muscle and adipose tissues extract triglycerides from VLDL, turning it into low-density lipoprotein, LDL. Peripheral cells take up LDL by endocytosis using LDL receptors. Cholesterol is used in cell membrane and other functions. Excess cholesterol is exported from the cells and delivered to high-density lipoprotein, HDL, to be returned to the liver in a process called reverse cholesterol transport. The liver uses cholesterol to produce bile. Bile is secreted to the intestine, where it helps break down fats. Part of this bile is excreted in feces. The rest is recycled back to the liver. LDL has the highest cholesterol content and is the major carrier of cholesterol in the blood. High levels of LDL in the blood are associated with cholesterol plaque buildup and cardiovascular diseases, such as heart attacks and strokes. For this reason, LDL is known as bad cholesterol. On the other hand, HDL is called good cholesterol because it removes excess cholesterol from tissues and the bloodstream. Common drugs used to lower cholesterol include inhibitors of endogenous cholesterol production, inhibitors of intestinal cholesterol absorption, and inhibitors of bile reuptake.
Okay, كيف ما شفنا هنا in this animation, lipid metabolism and the lipoproteins are responsible for carry cholesterol and triglyceride in the body. The major carrier of cholesterol is low density lipoprotein, okay? And the major carrier of triglyceride, chylomicrons, and very low density lipoprotein. Triglyceride, if its level elevated more than 500 to 700 milligram per deciliter, may lead to acute pancreatitis, and this is emergency case and needs immediate intervention. For this reason, we have to treat hyperlipidemia, okay? Also, we have good cholesterol or good lipoprotein اللي هو من high density lipoprotein. Why? Because it carries the cholesterol in opposite direction. Okay, all lipoproteins carry the cholesterol and triglycerides into different parts of the tissue, including arteries. نحن مهتمين بإيش هنا؟ arteries because we be worried about formation of atherosclerosis and occlusion of this blood vessels, okay? But high density lipoprotein, it carries the cholesterol from different parts of the body, including arteries, into the liver to be recycled and excreted كيف ما شفنا هنا through the bile, okay? And through the feces. So high density lipoprotein is responsible for hemostasis of lipids in our body. Okay, فعشان هيك مفروض يقعد in high levels in our body, not low levels, okay? Because it makes balance in lipids profile. High density lipoprotein maybe we found it's low in heavy smokers, okay, and also in diabetic patient maybe will be found low. So هنا هيجد high risk of a heart attack. لو جينا هنا وانتقلنا management of hyperlipidemia، هي مفروض أول حاجة هتجد إيش diet control and change the lifestyle، يعني to exercise and minimize fat saturated fat diet. كذلك minimize protein, especially red meat, because contain specific toxin may lead to the injury to the endothelial tissues. كذلك if the patient alcoholic, should be stop alcohol because alcohol associated with increased triglyceride level. وقلنا نحن triglyceride elevation may lead to acute pancreatitis. Okay. نجول أهم نقطة عندنا نحن as a pharmacologist هي anti-hyperlipidemic drugs. Okay. عندنا هنا 7 groups of anti-hyperlipidemic drugs. هنا من statins, Fibrates, Niacin, resins, ezetimibe, omega-3 fatty acids and newer agents. Statins تعتبر the most important group because تعتبر drug of choice for hyperlipidemia in most of the cases. Also because have not just anti-hyperlipidemic effect but also لقوها انها تدير شنو عندها anti-inflammatory effects على blood vessels arterial blood vessels. كذلك عندها anti-platelet effects. كذلك تدير stabilization of atherosclerotic plaque. For this reason statins تعتبر standard practice in treatment of acute coronary syndrome regardless of lipid profile. حتى لو كان patient هذا عنده normal lipid profile وكان عنده history of acute coronary syndrome المفروض يوصفوا له ايش statins. اوكي هذه قلنا the most important group وهذه طبعا هتشتغلنا على من على LDL C يعني على low density lipoprotein. اوكي اللي هو يعتبر major carrier of cholesterol. عندنا second group هي fibrates. اوكي مع omega 3 fatty acids are responsible for reduction of triglyceride levels. اوكي يعني fibrates and omega 3 fatty acids هيكون main effects على من على triglycerides. تمام. Also we have niacin. niacin هو فيتامين B3 ومسؤول على ايش يعتبر مهم because يعتبر raising agent لمن high density lipoprotein. high density lipoprotein can be raised by niacin. We have also resins أو يقولها bile acid sequencing agents. ezetimibe هيكون ال main mechanism of action وين on the intestine. okay and newer agents هنحكوا عليهم briefly هي more used in homozygous hyperlipidemia. طبعا نحن عندنا primary hyperlipidemia and secondary hyperlipidemia. primary hyperlipidemia يكون mainly نتيجة familial and genetic disorders وهن classes. والsecondary نتيجة لما يقسموا فيها ممكن hypercholesterolemia or hypertriglyceridemia or both. السبب حيكون different causes ممكن disease or drugs or كيف ما قلنا بدري على alcohols may elevate levels of triglycerides. Another important point بكم تعرفوها إن عندنا two important enzymes هنحكوا عليهم in the mechanism of action of these drugs. لكن بكم تعرفوها إن من lipoprotein lipase enzyme responsible for hydrolysis of triglycerides into free fatty acids. Okay. Another enzyme is the HMG coenzyme A reductase enzyme responsible for synthesis of cholesterol عن طريق mevalonic acid عن طريق من قلنا HMG coenzyme A. يحول HMG coenzyme A into mevalonic acid and then mevalonic acid give cholesterol. Okay. So let's start with the first group اللي هي من statins. سموها statins لأن كلها ينتهي بsuffix ايش statin. لو شفنا هنا atorvastatin, flovastatin, lovastatin, beta-vastatin, bravastatin, rosuvastatin and simvastatin. كلها ينتهي بsuffix statin or vastatin لو نحن بنحفظون. اوكي حقين statins معناها نعرفون ايش انه anti-hyperlipidemic drugs. Another name of statins وعن طريق النيم هذا هنقدر نعرفه mechanism of action of these drugs competitive inhibitors of HMG coenzyme A reductase. okay هذا هنقدر نعرف منها mechanism of action of statins. نفس ما قلنا statins تعتبر standard practice in the treatment of acute coronary syndrome because not only have anti-hyperlipidemic effect but also لاحظوا ان the stabilization of atherosclerotic plaque عندها anti-platelet and anti inflammatory effects on the blood vessels. Okay. Statins, لو جينا شفنا pharmacokinetics, all these statins will be given by oral administration. absorption بتاعها يكون variable. عندنا ممكن fluvastatin هيكون completely absorbed. Another important point نبيكم تحفظوها عندنا simvastatin and lovastatin هيكون ايش prodrugs، يعني هيصير activation after their digestion. okay. من هذين lovastatin and simvastatin, but other statins هيجدن ايش inactive forms. their bioavailability also varies. هنلقوا for example لو خدينا atorvastatin 12% while fluvastatin 30%, so there's variation in their bioavailability. THAF, very important to know, have rosuvastatin have long half-life, حوالي 20 hours. Then we have betavastatin and atorvastatin عندنا long half-life. okay. أيضا بنعرفوا إن these drugs prescribed mainly in the evening. okay. يعطوا فين نقول patients ياخذها at night because the synthesis of the cholesterol mainly هيصير وين أمتى at the night. okay. with exception of those اللي قلنا عليه دول اللي عندهم long THAF, for example rosuvastatin. okay. and their metabolism, these drugs most of them metabolized by cytochrome P450, معناها عندها lots of drug interactions. okay. and atorvastatin, lovastatin and simvastatin are metabolized by isoform 3A4. okay. be careful about this with drug interactions. Any drug may induce this enzyme or inhibit this enzyme, may affect in the efficacy and toxicity of atorvastatin, lovastatin, simvastatin. simva, lova, ator هذين metabolized by cytochrome P453A4 isoform. and the fluvastatin with lesser extent betavastatin and rosuvastatin عن طريق isoform 2C9. okay. but they have rosuvastatin and betavastatin and another pathway for their metabolism. من اللي هو not metabolized by cytochrome B450 من bravastatin not metabolized by this pathway. okay. and also they are excreted okay through the feces, and a small amount will be excreted through the urine. okay. These are the important points about the pharmacokinetics. جينا هنا mechanism of action of statins, because in the name تاعها competitive inhibitors of HMJ coenzyme A reductase. this enzyme اللي حكينا عليه إنه 3-hydroxy 3-methyl glutarate coenzyme A reductase responsible for the first step in the synthesis of cholesterol عن طريق تحويل 3-hydroxy 3-methyl glutarate coenzyme A into methylonic acid, and methylonic acid will give us cholesterol. okay. here statins عندها similar structure for HMJ coenzyme A, so they compete with it on the same catalytic site على الانزيم اللي قلنا عليه reductase enzyme, هذا HMJ coenzyme reductase enzyme. خلاص هنا صارنا inhibition for this enzyme, so here will not HMJ coenzyme A not converted into methylonic acid, so cholesterol will not be synthesized. شو حيصير عندنا هنا؟ here inside hepatocytes هيصير stimulation عشان يصنع receptors. okay. LDL receptors كيف ما شفنا فيديو قلنا LDL receptors are responsible for uptake of low density lipoprotein from the circulation. okay. هنا شفنا DNA هنا messenger RNA inside ribosome to synthesis new receptors. هيصير هنا عندنا upregulation of receptors. ليش؟ عشان بنعوض الكوليسترول اللي ناقص عندنا هنا تنبيه الليفر for synthesis of the bile، نبوه عشان صنعوا very low density lipoproteins. اوكي خلاص هنا حيصير increase numbers of low density lipoprotein receptors and upregulation on the surface of the hepatocyte. شنو حيصير هنا؟ يعني more uptake من LDL in the circulation low density lipoprotein، فبالتالي حينقص عندنا concentration of low density lipoprotein in the blood. أنا نقصنا معناها cholesterol levels. أوكي ونفس ما قلنا حينقص عندنا very low density lipoprotein، لأن مش حيصنع عندنا الكوليسترول inside the hepatocyte، معناها مش حيصير له release from the liver. Also will increase minimally increase in high density lipoprotein. تمام. This is the mechanism of action of statins as anti-hyperlipidemic agents. Okay. Therapeutic uses كيف ما قلنا statins تعتبر drug of choice in hyperlipidemia سواء primary or secondary hyperlipidemia. Most types of hyperlipidemia. كذلك طبعا ايش خصوصا اللي عندهم ايش high cholesterol levels. كذلك قلنا in acute coronary syndrome regardless of lipid profile، بغض النظر على their lipid profile useful لهم statins. adverse effects. statins مشكلتها أكثر حاجة شنو على الليفر؟ شو حيصير في الليفر؟ حترفع لنا amino transferase enzymes. اوكي فعشان هيك your patient لازم دي ايش قبل ما توصف للستاتينز لازم تطلب عليه liver function test LFT. اوكي لقينا normal amino transferase enzymes، معناها خلاص حنديروا له follow up after 1 to 2 months. اوكي بعد ما يستخدم ستاتينز، وبعدها نعودوه لو لقيناه normal ممكن نعودوه after 6 months or 1 year. Another thing maybe happen with statins هي myopathy. يجيك البيشنت يقول لك عنده ألم في proximal myopathy، ألم في العضلات. اوكي هنا لازم شنو نديرو تيست لكرياتين كينيز انزيم. لو كان elevation معناها نديرو discontinuation of statins. وهنا مين يصير امتى؟ لو كان patient ياخذ other drugs combination therapy، ممكن other drugs ممكن يسبب حتى يزيد risk of myopathy. هنا ليش نحن خايفين myopathy؟ لأن myopathy قلنا myoglobin urea. okay and myoglobin urea may lead to renal damage. تمام. عندنا other طبعا خاطئ إن ممكن حيصير عندنا GIT symptom with these drugs. أيضا ما ننسوش إن drug interactions قلنا عليه، لأن قلنا معظمهم يصير الميتابوليزم عن طريق cytochrome B450. أوكي كذلك فأي drug ممكن يصير له يدير enzyme induction or inhibition for these isoforms اللي قلنا عليه 3A4 or 2C9، معناها هنخافوا من risk of drug interaction and maybe increased risk of liver toxicity or muscle toxicity. okay كذلك not just drugs، ممكن أيضا foods زي grapefruit. لاحظوا إن لأنه هو enzyme inhibitor may increase risk of toxicity of statins. contraindications of statins مفروض ما ينعطانش pregnancy عشان هو teratogenic for fetus. كذلك lactating women. كذلك عندنا children. اوكي لو كان child with hyperlipidemia أفضل ما يصفولش statins contraindicated. كذلك معظم anti-hyperlipidemic drugs not preferred to be prescribed for children below 16 years. أقل من 16 سنة الأفضل ما يصفوش لهم. أوكي خصوصا لو كانوا young أقل من 8 سنوات. هذه never be given because نحن عارفين إن myelination of the spinal cord حيصير له complete أمتى after 8 years. health عندنا هنا fibric acid derivatives or fibrates هذه second group fibrates drugs Gimbrazil and fenofibrates كذلك another one bezafibrates Gimbrazil and fenofibrates their pharmacokinetics they are well absorbed but highly binding to the plasma protein خصوصا من حوالي 95% يصيرلها binding to plasma protein معناها هنا حخافوا من ايش اخرى drug interactions drug interaction كذلك لأن Gimbrazil حوالي تقريبا 70% excreted unchanged mainly in the kidney معناها حنخاف أيضا لو كان البيشنت عندنا renal impairment كذلك statins لو كان البيشنت عندنا renal impairment or hepatic impairment مفروض إنه be careful or contraindicated يعني relative contraindicated يعتبر هنا لو ردينا هنا fibrates Gimbrazil and fenofibrates يعتبر حتى هو برودراج يصير له activation side property اوكي تحول الى active metabolite and excreted بعدين after metabolism through the kidney the main mechanism of action of these drugs عندنا هنا في receptor اسمه peroxisome proliferative activated receptor alpha هذا يعتبر transcription receptors or nuclear receptor قاعد على النيوكليوس This receptor is responsible for transcription of lipoprotein lipase enzyme. قلنا علينا lipoprotein lipase enzyme is responsible for hydrolysis of triglycerides. اوكي عشان هيك قلنا fibrates هي mainly حيجي الإفكت متاعها يمن على triglyceride level نقصا triglyceride level because their mechanism of action وين على lipoprotein lipase enzyme. اوكي قلنا this receptor peroxisome proliferative activated receptor alpha عندها ligands من بين المن these drugs fibrates drugs اوكي كذلك الاكسونويز يعتبر ligand for this receptors اوكي خلاص when fibrates bind to this receptor شنو حيصير عندنا هنا هي حيصير activation هنيه المن transcription of lipoprotein lipase enzyme معناها synthesis of lipoprotein lipase enzyme خلاص هنا بعد ما صنع lipoprotein lipase enzyme حيدينا hydrolysis of triglyceride الموجود very low dense lipoprotein and chylomicrons خلاص هنا درسنا معناها level of triglycerides اوكي لأن حيتحولا إلى إيش هذه triglyceride into fatty acids يصير hydrolysis into fatty acids يصير oxidation ويتحول إلى oxidation products. Another effects of fibrates على ApoC3 synthesis اللي نقصنا لنا كذلك ApoA1 and ApoA2 synthesis حيزيد و they are responsible for synthesis of high density lipoprotein ApoA1 and ApoA2 synthesis. Okay هذه هي mechanism of action fibrates قلنا وين على lipoprotein lipase enzyme يديلها increased transcription because binding to receptor شنو اسمه nuclear receptor اسمه peroxisome proliferative activated receptor alpha هو نفس المكان اللي حيشتغل فيه omega 3 fatty acid okay remind this point therapeutic uses خلاص ممكن نعطوهم different types of hyperlipidemia خصوصا اللي هي associated with hypertriglyceridemia اوكي كذلك لاحظوا ان has good effect in this beta lipoprotein هذوما اللي عندهم intermediate lipoprotein maybe يكون high adverse effects حتى هو بجانب GIT symptom هي ممكن تكون dyspepsia diarrhea nausea okay and vomiting associated أيضا مع increase liver enzyme okay and the muscle tenderness كذلك associated with fibrates مشكلته associated with gallstone formation ليش؟ لأن شنو حيزيد لنا هو يزيد لنا الكوليسترول conversion into the bile okay more cholesterol excreted into the bile يعني معناها risk of gallstone formation. عشان هيك contraindicated in the patients with gallstone. اوكي شوفوا هذا الكرتون انا شفتوه قال لك if it tastes good it's probably bad for you. يعني اي طعام الطعم تسمعها معناها عارفه انه bad for your health اوكي and your body. طبعا هذا هو الاسم التجاري في جيم برازيل يقول اللوبيد. اوكي ايضا adverse effects انه هو عنده drug interaction because لأن هنا highly binding to the plasma proteins. اوكي عندها many drug interactions خصوصا مع warfarin. اوكي كذلك نفرض ان احنا هناخذ ان combination therapy is important in treatment of hyperlipidemia. يعني نعطي 2 anti hyperlipidemic drugs but be careful about these combination therapies because for example gilprassil never be given with simvastatin. ليش؟ because also other statins اوكي ما يفضلش انه ينعطى مع جلبرازيل. why؟ because gilbrazil undergo into glycosylation. also statins undergo into glycosylation so هيصير هنا عندنا interaction at this step. okay the drug of choice with statins من fibrates هو من Fibrates يعتبر هو drug of choice with simvastatin or other statins. contraindication نفس ما قلنا بدري pregnancy lactation statins كذلك hepatic adrenal dysfunction وكذلك قلنا patient with gallbladder disease لأن قلنا risk of gallstone formation. third one هو niacin or nicotinic acid. كنت تذكروا فيتامين B3 NAD plus هذا يعتبر important cofactor in many reactions in our body the biochemistry. okay but niacin حيكون عنده anti hyperlipidemic effect at grams doses. يعني بعد ما ينعطى قريب من 1.5 جرام into 3 جرام. لكن nicotinic acid alone ما عندهش anti hyperlipidemic effects. okay طبعا قلنا هو ناخذه انه هو the main elevator of high density lipoprotein اللي هو يعتبر دهن النافع اللي قلنا عليه good cholesterol. هو اكثر واحد هنلقوه يرتفع عن طريق this drug niacin. اوكي بس ايضا niacin may reduce very low density lipoprotein and lipoprotein هذا اللي هو وين موجود في الاتروسكليروتيك بلاك. niacin mechanism of action mainly احفظوها هنا وين هيكون mainly on adipose tissue. عشان حيدر لنا هنا niacin هو هيدينا inhibition lipoprotein lipase but where in adipose tissue. هيثبت لنا lipoprotein lipase معناها هنا مش هيصير conversion of triglycerides in adipose tissue into free fatty acids. اوكي معناها هنا هينقص release of free fatty acids. ونحن عارفين ان lipid metabolism تعتبر cycle. اوكي هنا بعد decrease of free fatty acid release خلاص هينقص هنا free fatty acid circulation معناها low level will be returned to the liver. okay liver typically free fatty acid for synthesis of triglycerides. يعني معناها نقصنا تصنيع من triglyceride synthesis and we know that triglyceride synthesis is important for synthesis of very low density lipoprotein. يعني معناها نقص عندنا very low density lipoprotein وبالتالي نحن عارفين ان very low density lipoprotein سيلا ميتابوليزم يعطينا low density lipoprotein هينقص عندنا الليفل. as the end result هنلاحظوا ان هيجي عندنا high concentration of high density lipoprotein in the blood. تمام كذلك لاحظوا عندها effects أيضا على plasminogen and fibrinogen is important in the hemostasis. okay and the platelets and the thrombus formation. هذا orally given قلنا grams 1.5 3 grams to obtain the anti-hyperlipidemic effects. طبعا قلنا therapeutic in different types of hyperlipidemia خصوصا لو كنا نحن patients عندنا low low levels of high density lipoproteins بيكونوا زي ما قلنا عليهم من smoker. اوكي ممكن نعطوهم ايش niacin. Adverse effects of niacin have many side effects, but the most common side effects هي كيف ما نشوف هنا في picture هي cutaneous flush. cutaneous flush يحملها في الوجه بسهولة. هذه هي لاحظوا انها نتيجة by activation of prostaglandins. Okay, prostaglandins is activation bind to their receptor and cause cutaneous flush and inflammatory response. ممكن هذه نتغلبوا عليها. هي طبعا بعد continuous use of niacin حيصير لها side condition هذه، لكن ممكن نعطوا our patient ايش aspirin or other non-steroidal anti-inflammatory drugs to overcome of these continuous flushing. اوكي كذلك ايضا النياسين ممكن يدونا rare but can be happen macular edema، كذلك hepatotoxicity، كذلك هو ممكن يدينا impairment in glucose tolerance يعني يزيد لك risk of diabetes. اوكي كذلك لاحظوا ان not good if given with oral hypoglycemic drugs. الأفضل مع من ممكن مع الأنسولين patients ياخذوا الأنسولين ممكن نصفولهم نياسين، لكن مع oral hypoglycemic لأن لنا increase risk of elevation of blood glucose levels. But the most common side effect هي إيش continuous flushing. Bile acid binding resins أو يقولها sequestrant agent bile acid sequestrant drugs and cholestyramine, cholestyramine and cholecystyrene. These drugs, because they have large molecular weight and they are water insoluble and are not metabolized and excreted unchanged، هذين كلهم pharmacokinetics of sequestrant drugs خلنا إيش important in reduction of the cholesterol levels. هنشوفوا هنا mechanism of resins. طبعا لو عطينا طبعا هنعطوها oral شو حدير هي خلاص حتمشي الانتستين. طبعا قلنا ما يصيرلهاش metabolism ما يصيرلهاش change in the body، حتوصل هنا الانتستين unchanged. هي تعتبر chelator agent. شو حتدير هنا exchange anionic. هي طبعا عندها positive charge resin مرتبطة بالكلورايد ايون. شوفوا هيصير exchange with the bile acid. هنشوفوا هنا في GIT شو هيصير حترتبط من مع bile وتكون لك large complex insoluble complex excreted through the feces. اوكي هنا شو درنا هنا بعد ما درنا excretion bile بالطريقة هذه هنا عارفين عندنا anterior hepatic circulation. مفروض البايل acid والبايل return back to the liver عشان أيضا يصنع يخشون في تصنيع بايل acid. هنا شو صار عندنا reduction in the bile acid reabsorption. هنا نقص عندنا reabsorption into the through anterior hepatic circulation. معناها هنا الليفر تبي تصنع بايل acid هتزيد في تصنيع بايل acid synthesis. شو حتدير؟ هيصير upregulation أخرى من low density lipoprotein receptor. هنا صار لنا هنا upregulation for LDL receptors عشان تصير شنو uptake من low density lipoprotein اللي هو major carrier of cholesterol. شفتوا اللي هو مهم في تصنيع قلنا بايل acids. خلاص هنا معناه شو بدنا نحن هنا reduction of cholesterol level in the blood بالطريقة هذه. their side effects mainly حيكون طبعا نحدد لك ممكن constipation GIT symptom يعني ممكن constipation flatulence. كذلك هي أهم حاجة حتدينا interference with absorptions of many drugs for example tetracycline, aspirin, phenobarbital, thiazide, digoxin, warfarin, pravastatin and pravastatin. يعني شفتوا statins هذينا شفتوا حتى يصير interfere with absorption of these ستاتينز مع لو عطيناها مع كوليستيرامين and كوليستيرول، عشان هيك نحن in combination therapy of anti-hyperlipidemic drugs. كيف نديرو من الحل هنا؟ هنديرو إن these drugs should be taken at least 1 to 2 hours before or 4 to 6 hours after bile acid binding resins. اوكي، يعني نعطوهم قبل ما نعطوا كوليستيرامين for example or كوليستيفول. اوكي، والله ممكن بعدها ب 4 or 6 hours. اوكي، عشان هنا ما نديروش reduction of absorption of these drugs. Therapeutic uses طبعا in combination therapy with other anti-hyperlipidemic drugs ينعطى different types of hyperlipidemia. كذلك استفادوا من انه هو interfere with the absorption of digoxin، معناها ممكن نستخدموه in digoxin toxicity digitalis toxicity لأن هيدير له excretion. كذلك لاحظوا ان البرايتس حتى تصير نتيجة bilistasis اللي عندهم biliary disease، اوكي obstructive disease، ممكن يصير يعني عندهم increased concentration of bilirubin ويديرلنا ايش bilistasis ويديرلنا برايتس حكة في الجلد، ممكن يعطوا كوليستيرامين and كوليستيفول to excrete the excess biles الموجودة in the body. أيضا كوليستيفيلام لاحظوا إن lower blood glucose level، كوليستيفيلام lower blood glucose levels فيعتبر very nice drug. أوكي، كذلك إنه هو يعتبر the least side effects with the أو lower side effect than the other sequestrant drugs. عندنا هنا كوليسترول absorption inhibitors اللي هو من ezetimibe، حتى هو حيكون الشغل mainly وين in the intestine، but ezetimibe لو قارناه مع sequestrant drugs هو is readily absorbed in intestine cellular metabolism and not interfere with the absorption of other drugs اللي هنا كيف ما صار interference with resins. اوكي، ezetimibe قلنا is readily absorbed in intestine، يعتبر هو least side effects than the other anti-hyperlipidemic drugs. كذلك قلنا هو doesn't interfere with the absorptions of other therapy أو other medications. mechanism of action كيف ما قلنا mainly حيشتغل لك وين in small intestine as jejunum، interfere قلنا with the absorption of the cholesterol dietary and biliary cholesterol absorption. طبعا هو عنده كي synergistic effect with statin. لو احنا شفنا هنا هو ميزته ان لو اعطيناهم combination therapy with statins، شوفوا هاي statins حيشتغل لنا mainly وين in the liver in reduction of LDL levels. okay، while ezetimibe أو يقول لك cholesterol absorption inhibitors mainly حيكون on the intestine mainly in the jejunum will reduce the other biliary both biliary and dietary cholesterol، هينقص absorption of biliary and dietary cholesterols، بالتالي حيصير لنا reduction in the cholesterol levels. خلينا نشوف الفيديو هذاي ويعتبر quick revision يدلنا على
we will cover lipid lowering agents.
traditional
We will cover
therapies.
statins, fibrates, niacin,
طبعا
bile resins,
ezetimibe mainly حيكون side effect بتاع diarrhea.
The setting for our scene is Michelangelo's studio, where several of his assistants are going about their days. Let's start by drawing a statue in the lower left corner. This statue will represent statins, our first group of drugs in this category. Statue, statin. Examples of statins include atorvastatin, simvastatin, lovastatin, and many others, all ending in the suffix stat. Note that we drew this in the lower corner because statins most prominently affect low-density lipoproteins medications share the common property of favorably affecting various parts of a patient's lipid profile. For example, lowering the low-density lipoprotein or triglyceride levels or increasing high-density lipoprotein levels. However, each drug group here is known for most affecting a particular component. For example, statins are most known to reduce the level of low-density lipoproteins, LDLs, so we have to put it in the lower corner. A test question might present a patient whose LDL levels are normal, but then asks what can be given to raise low HDL levels. Or a question might present a patient with sky-high triglycerides. The answer to these vignettes and more to come. Continuing with statins and the statute, statins work by inhibiting the enzyme HMG-CoA reductase, which is represented here by the inscription at the foot of the statute. While generally well tolerated, statins have two notable side effects that you will see regularly in clinical practice. The first is myopathy, represented by the wimpy, inflamed muscles in his thighs and arms. Patients will complain of muscle aches and weakness. Fibrates and niacin, two other drugs we will introduce in the scene, also have the same side effect of causing myopathy, so patients are at increased risk when taking combinations of these for increased effect. In practice, patients are usually switched between various statins until a tolerable one is found. A second, less common side effect of statins is hepatotoxicity, which is represented here by the inflamed and bulging liver. Patients must be monitored for elevated liver enzymes. To recap, with statins, you want to remember that they primarily affect LDL levels by inhibiting the HMG-CoA reductase enzyme in the liver, and that the side effects are myopathy and liver toxicity. Moving on to fibrates, we will draw a big pile of fibers next to the statue. Examples of fibrates include gemfibrozil, clofibrate, bezafibrate, and fenofibrate. The main clinical effect commonly tested is that fibrates reduce triglycerides, represented here by three glistening orbs. The mechanism of action of fibrates is increased lipoprotein lipolysis, which is why this assistant has big fat lips. Also, he's reaching up to feed his pet parakeet, which is perched on high. Fibrates activate the PPAR alpha receptor for an increase in HDL synthesis, hence the parakeet up high. Like statins, fibrates can also have the side effect of myopathy, which is why this artist has wimpy, red, inflamed muscles like the statue. When you have a patient on both statins and fibrates, expect muscle pain. This artist is also standing on a stone platform to represent a second notable side effect of fibrates, gallstones. A question might present a patient with normal LDL and HDL levels but elevated triglycerides. What do you prescribe? Fibrates. Next up, niacin. Let's draw sunlight streaming in from a window. Sunlight, niacin. Like most windows, this one is up high. That's because niacin is known to improve high-density lipoprotein levels. Look closely, and you'll notice that by some weird quirk of physics, there are exactly 3 beams of sunlight. That's to help you remember that niacin is also called vitamin B3, hence 3 beams of sunlight shining in from up high. A question might ask, a patient presents with a normal LDL level but decreased HDL level. What medication would bring that HDL level up? Niacin. On to niacin's mechanism of action. Let's draw a chubby assistant with a belt tightly squeezing his fat waist. This belt has 2 effects. First, niacin inhibits lipolysis in adipose tissue, which is why his lips are bulging. Second, niacin inhibits hepatic VLDL synthesis indicated by his liver bulging. His liver is not red and inflamed to indicate damage. Here it is the normal brownish color, but it's just inhibited by this very tight belt. Now let's start drawing another assistant who will demonstrate important side effects. First, note that his face is red and flushed, a symptom often encountered upon administration. You can prophylax against this by combining niacin with aspirin, which is why his ass is so red. Along with flushing, niacin causes vasodilation, which decreases produced by niacin. Moving on to bile resins. Let's draw a stone fireplace off to the side with a big lump of coal. Bile resin agents include cholestyramine, cholestyphol, and cholecevulin, hence why we drew coal. Let's draw another rotund assistant snacking on raisins, specifically bile raisins, and gross, he's puking his guts out. Patients complain that bile resins taste terrible. Bile resins work by blocking intestinal reabsorption of bile. Let's have him holding his stomach. As you can imagine, mucking with intestinal absorption has the side effect of some abdominal discomfort. See those 3 glistening orbs above the fireplace? Triglycerides. Bile resins slightly increase triglycerides, a fact sometimes tested because it's a bit counterintuitive since we usually want to lower them. However, bile resins are useful when the patient's triglycerides are well controlled and we want to lower LDL levels. We drew a stone fireplace. Remember what we used stones to represent when introducing fibrates? Gallstones are also a side effect of bile resins, like cholestyramine. The last drug is ezetimibe, and we're going to use a zebra for this. We'll have the zebra entering the studio because ezetimibe blocks cholesterol absorption at the intestinal enterocyte. Notice that our zebra is blocked from entering too far. What's that coming out of this zebra's rear end? It looks like diarrhea, a common side effect. That's all the lipid-lowering medications now. Remember that questions often test the notable effect of each. To summarize, we have the statue representing statins in the lower left because they lower LDL levels. Fibrates, a pile of fiber, are also low in the scene because they lower triglycerides, 3 glistening orbs. Niacin, as sunlight, the 3 beams of sunlight coming through the window, HDLs. Bile resins as a yucky snack, and the ezetimibe zebra blocked from entering the studio because ezetimibe blocks cholesterol absorption at the intestinal enterocyte. As you look back, you'll notice that each of these drug groups has a different mechanism of action. Each affected a different part of cholesterol metabolism. Because of this, these drugs are often given in combination for additional effect. Well, that's it for the lipid-lowering medications. Thank you for listening.
اوكي، شفنا هنا ان بس نزيد هذه يعني ما قلتهاش الكامبادي عن نياسين. side effects عندنا gout والنقرس hyperuricemia because interfere with secretion of uric acid in the renal tubules. Okay, عرفنا نقول هالنقطة هاي. Okay, now we move to omega-3 fatty acids. omega-3 fatty acids عبارة عن إيش هنا؟ polyunsaturated fatty acids. They are given in doses 3 to 4 grams. نحن عارفين إن omega-3 fatty acids may be obtained from plant source or animal source fish. أكثر حاجة هنا التونة، لحم التونة and salmon. أكثر حاجة الأسماك اللي هنا يعيشون في cold water. طبعا omega-3 fatty acids الفكرة متاعها كنت تذكروا قلت لكم هي will lower triglyceride level نفس fibrates. هيجد الأكشن بتاعها mechanism of action same as fibrates because they activate peroxisome proliferative activated receptor alpha. For this reason they will reduce triglycerides. Okay, يعني anti hyperlipidemic effect of omega-3 fatty acids عن طريق activation of peroxisome proliferative activated receptor alpha. But also because تعتبر هي من eicosanoid group فعندها anti-inflammatory and anti-arrhythmic anti-platelet effects عن طريق انها interfere with arachidonic acid production. There's competition between omega-3 fatty acids and arachidonic acid. فهتقعد ايش لو هي صار لها الميتابوليزم pathway of اللي هي المفروض يصير على الارachidonic acid هتصير على الاوميجا 3 fatty acid هتعطينا شنو non-functioning or inactive prostaglandins. هذه فكرتها as anti-inflammatory and anti-platelet effects
لأن هنا هيعطن inactive prostaglandins. But common side effects of omega 3 fatty acid هتهنا GIT symptom، nausea ممكن تجيلك، gastritis، increased risk of bleeding لأن قلنا لو قدرنا in combination with other antiplatelet or anticoagulant drugs because قلنا عندها antiplatelet effect، تعتبر هي good drugs or good supplements in many conditions. Omega 3 fatty acid عندها different uses, clinical uses. For example, not just anti-hyperlipidemic، قلنا هنا anti-platelet، anti-inflammatory في الأتوبي معناها نقدر نستفيدوا منها، كذلك عندها استفادة منها يستفيدوا منها أيضا. لاحظوا أنها good result تعطي في الأوتيزم، في الchildren اللي عندهم autism.
Here, newer agent for treatment of dyslipidemia or hyperlipidemia. There are many of new drugs, but they are expensive. Also, they are mainly used for homozygous patients because homozygous patients not responded for traditional anti-hyperlipidemic drugs. فهي هذين drugs هذين preserved for homozygous patient mainly. ممكن يستخدمون في بعض الحالات in combination therapy. For example عندنا microsomal triglyceride transport protein inhibitor prometabide، mibomersin intestinal inhibitor for ApoP100 synthesis. Okay. هنا عندنا example PCSK9 inhibitors، هنا هذين monoclonal antibodies. protein convertase substituting hexane 9 inhibitors long name. اوكي، شنو فكرة البروتين هذاي؟ نحن عارفين ان low density lipoprotein receptor قاعدين وين on the surface. اوكي، but there is a protein اللي هو هذا اسمه PCSK9. اوكي، bind to this receptor يديرلنا ايش؟ degradation and hydrolysis. اوكي، الفكرة انه نصنع inhibitor for this protein. اوكي، معناها هيك شنو ضمننا؟ هنا ان long stay of this receptor low density lipoprotein receptors هيقدر more time on the surface، معناها more uptake for low density lipoprotein، هيقدر high numbers of low density lipoprotein on the surface. اوكي، أنا شفتوها أنا في البيكتشرز، أنا شفتوا هذا PCSK9 protein convertase substituting hexane 9. أنا شفتوه synthesized and go to bind with LDL receptor. اوكي، ويدير له ايش؟ مفروض degradation وينقص النمبر بتاعها. لكن هنا شفتوا بعد ما صنعوا monoclonal antibodies افلوكوماب and ارلوكوماب هذينا يرتبطن this protein ويرتبطن شنو يصير هنا؟ معناها high numbers of LDL receptor will be preserved on the surface، معناها more uptake من low density lipoprotein. معناها هنا شنو نقصنا؟ cholesterol levels. اوكي، لكن هنا مشكلتنا هي نعطان in systemic routes because there are monoclonal antibodies. اوكي، انا شفتوها انا هي the picture. انا شنو حيصير هنا؟ حيرتبط ال LDL by its receptor وهنا يصير لنا reduction in the level of the cholesterol. لاحظوا انه ممكن ينقص لنا حوالي 70% من cholesterol level لو عطيناهم combination with other medications. اوكي،
خلاص لو درنا هنيه شفنا combination drug therapy عادي، ممكن قالك الأفضل إنك تدير combination عشان تحصل good results and best result in reduction of the lipid profile. For example, نعطوا fibric acid derivative with bile acid binding resins or statin with resins. niacin كذلك مع bile acid binding resins. niacin with statin، بس here تجد أنت شنو داير follow up for the liver functions and نفس ما قلنا muscles myopathy. اوكي. ستاتين with ezetimibe قلت لكم هذا good combination يعتبر. الستاتين طبعا نحن ناخذه قلنا drug of choice with الستاتين من الفايبريت شو ناخذه فينوفايبريت هو drug of choice with الستاتين. ممكن نعطوا 4 drugs لو كان severe hyperlipidemia. ممكن يعطوا resins, niacin and ezetimibe and statin. في example هنا حطيت لكم هنا سيمكور، هذا هو عبارة عن combination niacin with simvastatin tablets. كذلك توا introduced pharmaceutical industry هو من protein convertase subtilsin fixin 9 inhibitors اللي قلنا قلت لكم عليهن الروكوماب and إيفلوكوماب. كذلك ممكن يستخدموهن combination with statin and ezetimibe.
By the end of this lecture, if we do summary for the main effects of these traditional anti-hyperlipidemic drugs, قلنا the most common users anti-hyperlipidemic agents statins. هنلاحظوا main effect بتاعها يكون على low density lipoprotein. اوكي. وعندها moderate effect على high density lipoprotein and triglyceride. Fibrates هيكون main effect on triglyceride but also may reduce HDL كيف ما قلنا بدري عن طريق increased synthesis of ApoA1 and ApoA2. niacin هيكون main effect على HDL كيف ما قلنا بدري لأنه هو يعتبر HDL raising agent. Bile sequencer هيكون effect بتاعها minimal. اوكي. وميلي هيكون على من LDL. ezetimibe هيكون عنده effect بتاعها حتى هو يعتبر brief effect عنده على LDL, HDL and minimal effect on the triglyceride. Thank you for listening.